All right. Welcome to today's GHAPPcast. My name is Jordan Mayberry, and I am a physician assistant at UT Southwestern in Dallas, Texas. And I have Patrick Horne joining me today, a nurse practitioner from the University of Florida. And we will be talking a little bit about provider and patient support today. Thanks so much for joining me, Patrick.
Yeah, Jordan, thanks for having me. Excited to be here.
So when you are in clinic and you have diagnosed these patients with chronic liver disease or even cirrhosis, what are some of the resources that you turn to help better manage these patients?
Yeah, that's a good question. I have to say I don't probably use one particular resource exclusively. I really kind of use quite a few. Nowadays there's so many online resources available, but certainly some of the resources from GAPP that are offered are helpful, as well as AASLD. I might even go over and consider using some resources from, say, EASL over in Europe. Up to date is a really common and very quick one that I also use as well. So it's really a variety. I think it just depends on the situation, depends on the patient situation, exactly what sort of information I'm after at the time. So
yeah. So, as a provider, I personally can find it difficult to keep up with all of these clinical practice guidelines. There are a lot of different guidelines out there. There are a lot of different societies that are making these guidelines. Do you have some tools maybe that you can offer to other providers to help better understand these practice guidelines?
I myself will find myself frequently, going back and reviewing or refreshing my memory of the guidelines, even during during a clinic visit. I don't think there's anything wrong with that, because as you mentioned, they're changing. They can change very quickly. It's hard to keep up with them all, and so you may read them once, but then you may not remember. And I'd rather take the time to re-review something and make the right decision versus making the wrong decision. So, I guess my advice would be to try to stay up on the guidelines, but certainly don't hesitate to refresh your memory, go back, do a quick search, and kind of read through, especially when it comes to certain things, portal hypertension management. There's been a lot of changes in that area in the last several years. Hepatitis B is always a changing one that always can be a little bit confusing. And so I think my recommendation and what I do is if I'm not sure, I go back and look and I re-review and sort of make sure I'm on the right track.
I completely agree. I have been practicing for 11 years, and I can tell you that I still have a printout of the Hep B guidelines that I refer to on a regular basis, and also a printout of these new portal hypertension guidelines on, what is the cutoff for the FibroScan? What is the cutoff for the platelets? So I agree that this is not something that we have to memorize or expected to memorize, that you can always re-refer back to the guidelines. Now, things are changing so quickly in the treatment of both chronic liver disease and cirrhosis. How do you personally stay up to date on all of these changes?
Yeah, that can be a daunting task. Again, I don't think there's one single resource that I would say I use, but I try to, actively seek out continuing medical education, CME, whether that's and mostly through different societies, so through GAPP or through AASLD. Webcasts, podcasts such as this one, in-person meetings, virtual meetings. I try to read the high level, journals such as Hepatology and such, to try to keep up on it. But sometimes it's hard, and sometimes, I'll be honest, it may require a quick search on the internet and see what comes up. I'm not going to lie.
Yeah, no, I agree. There's a lot of new medications in this space. There's a lot of clinical trials and upcoming medications, so it can feel a little bit daunting. But there are a lot of great resources out there, and I think the takeaway is that sometimes we just have to keep going back to those resources.
I will say, in reference to medication specifically, especially if it's a specific medication I'm looking to say prescribe for a patient, or maybe they're on it but they have a question. I have actually found good, useful resources within the manufacturer's websites directly. So whatever that drug may be, it's usually pretty easy to find, and that's something that not only I can use in my discussion with the patient, but it's also a good reference that I can give them to take home, and maybe they can use on their own. That doesn't require like a membership to a society or some sort of restricted access. So, I think if it's around a specific medication for a specific disease state, I'll reference that as well, or look into that as well. You get access, to the package insert for the medication, as well as other things, patient assistance information, copay information. So I'll a lot of times, utilize that, especially when I'm wanting to give the patient a resource that they can easily access at home.
Yeah. Yeah. Speaking of resources for the patient, as we know, cirrhosis is a chronic condition, and this is something that our patients and their family members will have to deal with for the rest of their lives. How, as healthcare providers, can we better support our patients with cirrhosis?
Yeah, I think it centers around education, and I think it's re-emphasizing and continuing that education at every single visit, and even potentially in between visits, whether it's by phone or a telemedicine visit, or however your practice does it. But a patient, especially a newly diagnosed patient with cirrhosis, comes into the clinic and they're overwhelmed from the very beginning with all the things we talk about: HCC screening, signs and symptoms of decompensation, possibly the need of liver transplant in the future. They need ultrasounds, they may need endoscopies, maybe you'll do a fiber scan, X, Y, and Z. And so that can be overwhelming. And I think the old adage is patients forget 50% of what you talked about in a clinic visit the minute they walk out the front door. So I think it's just the continuing in education at each visit, and the emphasis and the continuing to re-emphasize these are the things to look for. These are the complications of cirrhosis. These are the things I want you to be aware of. And if you notice anything like that, and the way I sort of frame it is, even if you're not sure, I'd rather know and be able to reassure you that that's nothing to worry about than not know and it spiral and snowball into something a lot worse. And then we find out 4 or 6 months later at the next visit, when this is something we could have maybe dealt with early on.
Yeah, I agree. I think in addition to that, we have to realize that these patients are dealing with a lot, with a diagnosis of cirrhosis. Much like you mentioned, there's a lot of different tests that are needed. This is a chronic condition. And so we will be continuing to do tests and blood work routinely moving forward. So understanding that can play a role into their emotional and just their overall coping with the diagnosis. So just being there to support your patients emotionally and kind of meet them where they are. And also don't forget that this affects a lot of different people. It doesn't just affect your patients, but it can also affect the patient, affect their caregivers and loved ones. So being there to support their family members and also maybe provide some resources for the caregiver as well.
Yeah, no, completely agree. And the other thing I always try to remember is, cirrhosis is most likely not their only medical issue, right? So they've got multiple other medical issues. They may be seeing multiple other specialists. And so taking that all into account, that this is just one thing they're dealing with, and they've got others. I do want to ask you, actually, you mentioned caregiver resources. Do you guys at UT Southwestern have any specific caregiver resources that you go to, sort of your go-to resources?
Unfortunately, we don't have as many resources as I wish we did. It would be incredible if we had social workers and some more well-rounded care teams. But I think that can be difficult. So often we find ourselves as APPs kind of being that source of support. And I think that education and just also listening to our patients and their caregivers goes a really long way.
Yeah, I would agree. I'm in a very similar situation as you. So.
Okay, Patrick, this has been really informative. Thank you so much for joining us this afternoon.
Thank you. Thanks for having me.
Thanks all for listening to our GHAPP podcast.